Moving on to issues of health now, the global TB deaths have increased for the first time in 20 years. They rose from 1.4 million in 2019 to 1.6 million in 2021. It is also estimated that 1/3 of patients were not diagnosed and treated in 2022. UCT's Institute of Infectious Diseases says that this shows that the global health sector is failing dismally. Let's discuss this with UCT's Professor Helen Cox. Very good morning to you, Professor Cox, and thank you so much for your time this morning. I'm quite intrigued by the numbers here and quite interested to find out what were the factors that perhaps have caused a rise in the number of TB diagnoses.
So the number of TB deaths has increased primarily because of the disruption caused by the COVID-19 pandemic. We were making some progress in deaths caused by TB, so they were going down across South Africa and in many countries which have a lot of TB. But because of the COVID-19 pandemic, a lot of services switched to focusing on COVID instead of TB, and people were afraid to go to their healthcare facilities to be diagnosed. So it was difficult and that's why the deaths have likely increased in many settings.
So do you think perhaps, Professor, that during COVID there was a conflation of the two? Because the COVID symptoms were so flu-like and perhaps also TB-like, that generally we gravitated towards COVID and didn't really pay much attention to what the other causes of the symptoms may have been.
Yes, I think that was part of the problem. The symptoms are very similar, COVID being much more acute and TB more long-term. But yeah, and I think some of if people weren't really immediately acutely sick during the pandemic, they were kind of sent home because they didn't want lots of people with COVID in the health facilities. And then they didn't come back. And so that was probably the reason why diagnoses fell so much during COVID. Certainly here in Cape Town, the number of specimens sent to the laboratories for testing for TB was like 25% of what it was normally prior to the pandemic. So that's really what's caused the increase in deaths and why we need to do so much more for TB moving forward.
Let's talk about what could have come out as positives from COVID, including treatments. Can you take us through those?
Well, I guess the positives are that we now know that if the global community puts our heads together and puts a lot of money in, then we can really tackle major diseases that affect millions of people. Unfortunately, this hasn't happened for TB yet. We haven't put nearly enough resources into sort of research, to putting what we know works into practice. And that's why so many people around the world are not even diagnosed with TB when they should be. We know they're in their communities, but we're just not diagnosing them. So I think the world has learned that we can do a global response when we really put our minds to it. Also, I think we've realized the effect of pandemics on the economy and businesses and poverty as we move forward. And TB certainly has a dramatic effect in terms of creating more poverty and just an economic cost to countries who have a high burden of TB. So investing in more TB programs and research really pays off in the long term in terms of economic gains for countries like South Africa, which has a very high burden of TB.
Talk to us about, Professor, about various campaigns that are being put forward in order to make sure that safer, shorter, effective TB regimens are actually being made available to as many countries as possible.
Yeah, the global advocates have put together a number of sort of campaigns to make sure that this happens. And there are a lot of barriers, though, to getting access to sort of new diagnostics and new drugs, and they include sort of just the cost of them from the start off, and sort of patents and that get in the way of access to new drugs. And so there are new moves to get some new drugs, certainly for drug-resistant TB, um, cheaper globally, but they don't go far enough. We really need to make these a public good, and get them accessible to everyone who needs them through all of the healthcare services that there are.
Could you highlight for us some of the key outtakes from the research report that really came out of this, as well as how you're going to use some of those findings moving forward? I see you are actually preparing for a forum, a conference on the 22nd of September, which will once again focus on tuberculosis. And how will the outcomes from this report actually influence the conversations that are going to be had?
Yes, so next week is the second United Nations high-level meeting on TB. It's in the run-up to the UN General Assembly held in New York, and there will be a declaration that comes out of that meeting that really hopes to reinforce what we need to do for TB moving forward. There was a previous high-level meeting in 2018, and there were a lot of commitments made at that meeting, but unfortunately a lot were not met. Mostly because of COVID, but for some other reasons as well, that there just wasn't the political will. So we're really hoping that this time there will be political will moving forward. And from the report is also, excuse me, is also a follow-up to a report that was released in 2019 that outlines all the things that we need to do to really make a global response to TB happen. And this includes actually using the available diagnostics properly, getting access to them at all the points in the healthcare system where people seek care. So not just at tertiary hospitals, and some points where people have to travel long ways to get diagnosis. And I think the report also highlights that we need to, the response to TB needs to be community-led, and full of, and really have meaningful community engagement by people who are affected by TB. And this has been very much lacking in the response to date. It's been very medicalized, and a top-down approach. But we have learned from HIV in many settings that actually it needs the people affected by the disease to really guide the response, and then it will be much more effective in the long run. And so that's what we really need to work on for TB.